Today we're going to talk about a topic that's been in the news quite a bit. There are several angles to this issue, but the angle that we're going to look at is the psychiatric and the psychological part of it. Dr. Divya Nallur is a psychiatrist and an addiction specialist at Bangalore's People Tree Marga. She specializes in general psychiatry, addictions, and cognitive behavioral therapy. Thank you so much, Dr. Nallur, for joining us. Of course, we'll be joined in by our audiences soon with lots of questions on the topic. But, just before we started the chat, we were talking about different states reacting to the problem of addictions. And of course, there is a very big moral angle that comes up in our country. But, just as you're looking at the news and looking at, the prevalence of withdrawal, can you give us a little bit about what you're seeing and what are the issues that you're seeing in the period of this lockdown?
So most psychiatrists and most doctors would agree that we are seeing, and we expect to continue to see, an increase in the number of people who are withdrawing from various substances. And tobacco and or nicotine and alcohol being the most common substances in use in India, we're seeing withdrawal of those two substances extensively. And those who are using them, are continuing to use them, are probably buying them at premium costs. So the lower economic strata will be unable to afford it. And hence the lower economic strata of the population will be going into withdrawals much earlier than the people who probably have a stock of these substances at home. We're definitely seeing an increase in withdrawal.
Right. Just from the idea of what you're seeing in your own clinics, I understand that you work in a private hospital and you were saying that you aren't, the number of calls aren't very high, and like you rightly mentioned, it may have a lot to do with the socioeconomic strata. But what do you predict will happen after the lockdown? Do you imagine that a lot of your patients who are already signed up with you will be coming back with issues?
Yeah, I think not just addictions, mental health itself is a big crisis right now in the context of COVID-19. Because a lot of people are unable to get to their medications, a lot of the people are unable to get to their, psychological sessions or to their general reviews. So we do expect a sudden flood and we have stopped all routine, follow-ups. So once the lockdown is completed, we do expect a flood of problems with respect to mental health and addictions again.
Right. For the benefit of our audience, Dr. Nallur, I think it'll be great if you could just run us over what addiction means in these times, especially for those people who may not be aware that they may be having withdrawal. So just give us an introduction to the topic and then perhaps we can go into the questions.
So we are mainly talking about nicotine or tobacco or cigarette and alcohol addiction today. But if we just generally talk about addiction to a substance, be it any illegal or legal substance, we're talking about a person who has a constant desire to take this substance and finds that he or she has symptoms of craving if they don't take it. And if they don't take it, they have withdrawal symptoms, physical or psychological symptoms, which make them want to take this substance immediately. Those are the withdrawal symptoms. Each substance will have a different set of withdrawal symptoms, and we'll come to that later. And there's also, if you have a history of having taken any substance, be it tobacco, nicotine, or alcohol, or even for that matter, coffee, regularly enough and in a very patterned way over a period of time, that means your body is become dependent on it. So the core features are the craving to use it, withdrawal symptoms, some form of psychological or physiological withdrawal symptoms when you don't use it, a history of using it regularly for some time, use of that substance despite knowing about the harmful consequences of the substance. So people know that drinking alcohol every day is a problem and it's going to cause physical, mental, and psychological issues, but they continue to use it in that harmful way, then we call that the person may be dependent on that substance. And also if they have developed tolerance over time. So if you've noticed yourself having started off with maybe one cigarette only when you go out on parties or when you drink, but then have grown to have a cigarette every day, and now you're consuming a packet of cigarette. That we call as the body has developed tolerance to the substance to a degree. So if you notice that in your history that this has happened, that you've developed tolerance to the substance, that means you're likely to be dependent on that substance.
Perhaps we can start with, what withdrawal means for each of these substances. I would imagine that the larger prevalence is for nicotine, although you have mentioned that alcohol has its own different history. But for nicotine, what do people look out for at a very basic level?
So the reason I mentioned alcohol as a separate thing is because, yes, nicotine or tobacco, cigarette smoking, or even the tobacco, the oral nicotine that a lot of people use is the biggest addiction right now in India. But tobacco or nicotine dependence and its withdrawal symptoms, though terrible to manage or to go through, is not really medically dangerous. Whereas an alcohol withdrawal can become medically dangerous if not managed medically appropriately. Yeah. So if you're talking about nicotine dependence, be it oral nicotine or smoked nicotine, so the main withdrawal symptoms someone would find themselves having is probably irritability, easy agitation, a sense of restlessness, be it a physiological restlessness as in they're pacing a little bit, or a psychological restlessness, something restless inside of you. That's the main symptoms. Some people may also complain of headaches, insomnia, unable to sleep, or an increase in appetite. And some people may say that they have a sore throat or a cough after having stopped cigarettes. And also complain of, they may also complain of excessively getting noises being very sharp and irritating them. So people talking to them, any conversation is more irritating than usual. These are the common symptoms of nicotine withdrawal.
Right. Just listening to the symptoms of the withdrawal, it sort of makes me think that given the times and that most of us already face an increased sense of irritability, and it is allergy season. So I think the throat and the throat issues and the irritability and all of these will be common. So is there a differentiator that you would say that here's what you should definitely look out for, and here's when you call a doctor or see what you can do?
So a person with the history of an addictive use, having these symptoms, and these symptoms having increased in relation to stopping of the substance, of the nicotine used. That's the link that has to be made. Yes, people may be more irritable, more anxious, more depressed for various other reasons other than nicotine or tobacco withdrawal. But if you have a history of tobacco or nicotine use and you've recently stopped or decreased your use compared to previously, you've dramatically reduced use, and you have these set of symptoms, then you should seriously consider them as nicotine withdrawal symptoms.
Sure. Perhaps we can move on to how alcohol works then, and what does withdrawal mean for that, and how does it work in your body?
Yeah. So a lot of doctors right now, especially psychiatrists, are extremely concerned about the number of people who are dependent or have been misusing alcohol all this time and suddenly have no access to alcohol. So what alcohol is a depressant of your nervous system. So when you're constantly consuming alcohol, your nervous system is kind of drenched in alcohol. So it kind of has dulled your entire nervous system down a little bit. And so to function normally in the presence of the alcohol, the nervous system has overdriven that kind of the depressive effect of the alcohol. So it's kind of in an overdrive. And then when you suddenly stop alcohol, the overdrive of the nervous system is not stopped. It continues to be in overdrive. And that's the reason there's a severe amount of withdrawal symptoms with alcohol. So some people may find withdrawal symptoms to start within 8 hours of stopping alcohol, depending on the quantity of alcohol that they've been consuming.
Okay.
Someone who's consuming high amounts of alcohol and have not consumed anything for 8 to 10 hours may already start feeling tremulous or anxious. Yeah. The first few symptoms you would see of alcohol withdrawal would be either a mild tremor in your hands and feet, or a sense of anxiety, restlessness, and maybe increased sweating. The next few symptoms would be things like nausea, vomiting, unable to eat anything or drink anything till you've had a drink of alcohol. These, as I said, can start anywhere from 8 hours post last dose of alcohol, or may start, if the addiction is not that heavy, then it might start about 24 hours after the last drink. These then progress on over day 1, day 2, day 3 into more serious symptoms. The tremor may continuously increase, and what we're worried about is that they will go into a full-blown seizure. Proper fits, like someone with epilepsy would have a fit, the same kind of fit. And if the fit goes into what we call status epilepticus, as in the fit doesn't stop. Usually fits come in, you have a seizure for a minute or shorter, and then it goes away. But the risk is that you continue to have the fit continuously, take status epilepticus. And because of the risk of, in status epilepticus, you're not breathing properly, and so risk of respiratory arrest and stuff. So that's the risk. So if the tremors continue to worsen, you have insomnia, as in you're not sleeping, you're vomiting, you're not keeping anything in your intestinal system, and you generally feel horrible, then you have to take medical help immediately so that it doesn't go into the seizure. Occasionally, people don't go into seizures, but they go into what we call delirium tremens. Before that, hallucinations may start. So people may start seeing or hearing things that's not there. Yeah. So this is a severe withdrawal symptom as well from alcohol. Delirium tremens is an uncommon but serious complication of alcohol withdrawal. It's the most severe form of alcohol withdrawal. So if someone is very addicted to alcohol and have come off alcohol very suddenly, and they have not taken any medical help, then they're at risk of going into delirium tremens probably on day 2 or day 3 post stopping alcohol. It may be a bit longer in some people. During my career, I have seen people go into delirium tremens on even day 5 and day 6 post last dose of alcohol. So you have to be very careful about this. So what happens in delirium tremens is that it's like an acute confusional state. So these patients will not know where they are. They're completely confused. They're not oriented in time, place, and person. They're not stable on their feet. So there's general ataxia. And they may appear to have a fever. So high temperature may be there, or high blood pressure or low blood pressure may be there. Delirium tremens is a medical emergency and has to be treated in a medical setting. If anyone is having these symptoms, they must be rushed into a medical setting as soon as possible. Though mortality is low, but the risk is present. And permanent damage to the nervous system is also a problem with delirium tremens.
I'd like to roll back a little bit, and of course, you've explained to us the extent of how far a withdrawal can go. But just, I imagine that for a large part of our audience, the extent of addiction may not be quite as high, if I understand that right. So if we can roll back to understand how addiction works, and at what point are you really addicted to alcohol itself? Because I think that is always the big question that people tend to ask themselves, to say that is a couple of drinks every evening addiction? How do I define this? And if I run out of stock by the end of this week, what do I expect? And not necessarily for someone who is aware that they have a problem with alcohol addiction.
Yeah. So the definition for addiction is very simple medically. Like I said in the start of this conversation, there's 6 points. If you say yes to at least three of those, to make it more simpler, let's say we ask what is called the CAGE questionnaire, which is CAGE. So C for, have you ever thought you should cut down on alcohol? Yeah. And A for, do you get annoyed when people say you need to cut down on alcohol? And G for, do you ever feel guilty about having had a little too much, even if it's just the one time? Yeah. And E is, have you ever had it as an eye opener, as in first thing in the morning? So if the answer to any of those questions is yes, then the likelihood that you're dependent is very high. This is not a medical definition, but this is what we use for general public. It's called the CATE questionnaire. So that's a simple rule of thumb. So if the answer to any of those things is yes, then the likelihood is that you're dependent. If you're drinking every day, I would say you're dependent. It doesn't matter the quantity if you're drinking every day, because even in WHO guidelines, who say 2 units per female or 3 units per male, even they say that it cannot be a regular thing. It has to have breaks in between. Yeah. So if you've had years of regular drinking, it may be dependence. And like I said before, if there's tolerance development, as in you started off with beer and now you're on whiskey, or you started off with 1 drink and now you're on 3 drinks a day, that means you have become dependent on the drink. Or if you have any of the withdrawal symptoms when you stop. So say you run out of alcohol today and you feel fine for 5 days after, then probably you're not dependent. But if you do develop uneasiness, any symptoms or problems when you stop, that means your body was dependent on it.
Right.
No matter how mild it is.
Yes, absolutely. And so now going back to what you had described as the range of withdrawal symptoms that one might experience, is there a point at which, and I think we're all very aware of what to do when it's physical symptoms, where if it's an itchy throat and a small cough, we know that we're going to wait it out. Is there a point or a threshold at which someone, especially for alcohol, given the seriousness of it, that you would say at this point you should try consulting with a doctor? And given the times that access to a doctor is also not easy, what would you recommend? Should one go directly to a psychiatrist? Should it be a GP? If you could just run us through that process of decision making.
Anything, if it's just a general uneasiness, I would wait. But if you've developed a tremor in your hands, so you just put your hands straight out and look at the tips of your fingers. So stretch your arms right in front of you and extend all your fingers wide like that, straight like that, and look for tremors at the tip of your fingers. If there's a tremor, I suggest go see a doctor, even if it's just a GP. Yeah, and as soon as you go, you would say that I have this tremor and I have a history of alcohol, because a lot of doctors who are not psychiatrists right now are dealing with a lot to do with COVID-19. So their minds and brains are occupied with coronavirus. So for them to give attention to your withdrawal symptoms, you need to give them a history of alcohol consumption daily. I have been drinking, consuming alcohol every day, and over the last 3 days, I've stopped it, and I now have these symptoms. And then that's very clear evidence that you need treatment for alcohol withdrawal. So anything more than a mild uneasiness, don't manage at home. Go and see a doctor. So all private hospitals are open, so at least to see a general doctor. So you should see at least a general physician as soon as possible. And if your symptoms are higher, craving is higher, then you need to see a psychiatrist. And most psychiatrists are also available. All government hospitals, all DMHPs, so district mental health professionals are working. A lot of private sector is open. You can quite easily access someone, and do not ignore it and make it into a bigger problem before you see a professional.
Right. And I think that's a great point to be reiterated, to say that it's really important for you to spell out to your GP that you have a dependence on alcohol, because it is unlikely that your GP will think about that as the first line of diagnosis. Mm-hmm. But going on, I think the other question that we did get was, at what point, what warrants hospitalization for alcohol addiction?
So if the tremor is more than mild, so if you're unable to hold a spoon, you're unable to hold a cup, and it depends on a lot of factors why I would admit someone and why I would treat someone in the community. So So I'd get a liver function test done and see how good or bad the liver is, because the medications that we need to give to stop this withdrawal are sedatives, are strong sedatives. Yeah. So if I think I need to give higher doses of those medications to control the tremor and control the withdrawal symptoms, then you need regular monitoring. So every 90 minutes, a nurse has to come in, check your blood pressure, make sure you're breathing okay and all that. So that would mean you'd warrant admission. So like I said, even the slightest hint of tremor, visit a doctor. And if the tremor is not controlled with, minimal amount of sedative medications that we give, anti-withdrawal medications that we give, that would mean that if you need higher doses, that would mean that the doctor would suggest that this will have to be done in a hospital setting.
Right. Is there any level at which, you see that a patient is able to manage this by themselves at home, maybe for a lower level of dependence? Is there something that can be managed and people can cope by themselves at home?
If it's very low level of dependence, and especially if you still have a little bit of stock of alcohol with you, what I'd suggest is wean yourself off the alcohol slowly. So say you're someone who's regularly drinking 60 ml of alcohol every day. So start measuring and you have a little bit of alcohol left with you. Then what I'd say is pour in 50 ml tonight and dilute 10 ml with a diluent so that it looks like 60 ml to your brain, but you're actually having 50 ml. And then the next day you do 40, the next day you do 30 and 20 and 10 and then 0. So that by the time your stock is gone, your dependence on the substance is also very low. And hopefully you'll not have very severe withdrawal symptoms. So for someone with very minimal withdrawal symptoms, where just uneasiness is a problem and there's no tremor, there are no active withdrawal symptoms, what I'd suggest is hydrate yourself very well. Drink plenty of fluids, drink plenty of juices. If you can access some multivitamin tablets, especially we tend to load people with a specific multivitamin called thiamine. But
I'm sorry, can you repeat that?
Thiamine. So, can you hear me? So,
yes, now.
Just take a multivitamin tablet and eat healthy. Make sure you have plenty of vegetables and fruits in your diet and not just pure carbohydrate. So, and try to rest plenty. Make sure your blood pressure, if you do have hypertension and diabetes, make sure those things are well managed and you don't miss those medications. And with that, a lot of mild symptoms may settle down.
I think the parallel question then will be that, from a mental health perspective, and I suppose a lot of this is fairly psychological as well. What does one do to manage withdrawals, and what do you do with your mind at a time like this?
Yeah. So if you are having a medically assisted alcohol withdrawal, all those psychological aspects will also be managed parallelly. But if you, like you said, if it's someone with very mild addiction and is just coming off it, and there's no active physical withdrawal symptoms, but there's a lot of craving and there's a lot of, psychologically you're feeling sad or anxious that you're not drinking, but you're not actually having any physical withdrawal symptoms, then the best way to do is what you do to manage any other addiction. So you try and divert your mind to other places. You try and keep your mind active in other places. Be as active as possible. So ensuring you get some form of physical activity, though you're cooped up in the house. Make sure you exercise for 30 minutes at least a day. Make sure that you're not just sitting in front of the TV, and recognize the trigger points that make you crave for alcohol. So if it's a particular cabinet or there are empty bottles in the house, get rid of those things that make you crave for the substance. So maybe a particular song or a particular movie makes you, or sitting in front of the TV, you got into a habit of having a beer with you. So make sure you're not sitting in front of the TV in the same position as you would if you would have a beer in your hand. So changing the cues, psychological cues that you would give your brain is very essential, so that the brain does not feel the need to continuously think about alcohol.
Right. And likewise, I think because since we were talking about what you can do in terms of withdrawal, especially mild withdrawal for alcohol, can we address the same question for nicotine? Because that is possibly far more prevalent and may have solutions at home.
Yeah. So nicotine addiction is a lot more psychological than physiological. Yes, there are physiological symptoms, like I said, there's irritability, restlessness, and there are true problems. But as I said, they're not medically dangerous. So if you can make up your mind psychologically, if you can be strong, this is the best time to quit cigarettes or tobacco. If you manage to quit, you're in a zone where temptation is very less anyway. So psychologically, you have a booster already because anyway, it's not accessible easily. So what would you do? So like I said, for alcohol, psychological dependency should be fought with psychological tricks. So you'd keep your mind busy. You would try and identify the things that trigger your need for a cigarette. So you identify when is it that I'm most likely? So most people say the first thing as soon as I wake up is when I definitely need a cigarette and I cannot continue the day without it. And a lot of people say that it constipates. If they don't have a cigarette, then they're constipated as well, and hence they need a cigarette. So you recognize that the morning is the most hardest time for you. So you make sure that you're doing something pleasant in the morning that your brain will enjoy, such that your brain can try and avoid thinking about the cigarette. So maybe 30 minutes of some aerobic activity if you're young enough, or yoga or something to calm your mind, or listening to some music. It depends completely on what kind of a person you are. So making sure psychologically that you're sorted that way. Making sure you do some relaxation training exercises. There are quite a few relaxation videos on places like YouTube. You can put on some of those videos and follow those videos for relaxation training, so that a little bit of the restlessness and the anxiety can be managed through that. And like I said, again, if you do have a stash of cigarettes with you, then the best way to do it would be count down and slow down and slowly wean yourself off it. So if you're doing 8 per day, make sure you do 6 per day. So the initial part of the jump down can be dramatic. So a lot of the times when patients are admitted for a slow detox from nicotine, what we can potentially do sometimes is, even if they're smoking 20 cigarettes a day, we can go from 20 to 3 quite easily. So because the nicotine receptors need a little bit of nicotine to shut up and not cause too much trouble for you. So giving them that little bit is sufficient. So cutting down dramatically in the beginning and then slowing it down a little bit may be a good idea. So once you reach 3, then take a couple of days to go to 2, and then a couple of days to go to 1, and then to 0. Also, with respect to nicotine replacement products are easily available over the counter in all pharmacies. And there is a lot of evidence that nicotine replacement products do help in withdrawal. So there are a few products that are available. So there's a transdermal patch that's available that you can buy. So it's usually 7 or 14 milligrams transdermal patch that you can buy on the counter. 7 milligrams if you feel that you are smoking anything less than 10 cigarettes a day. And if you're smoking more than 10 cigarettes a day, then go for the 14 milligram patch. You basically put the patch on your skin somewhere on your upper part of your body after a shower and leave it on for 24 hours and remove it after 24 hours, have your shower, and then replace with another patch. You can do it for a few. So it gives a continuous supply of nicotine to the brain through your skin, hence decreasing the need for you to use oral or smoked tobacco. With this, there's also the gums or the lozenges that are available, nicotine gums or lozenges. They come in 2 milligram lozenges. You can take those and keep them in your mouth. So you put a patch on, and then if you have a sudden craving, excessive craving for a cigarette, so during the daytime, anytime, then you put a gum in your mouth, chew it a couple of times, but hold the juices in your mouth so that the nicotine gets absorbed through your oral mucosa, and then the acute craving for the cigarette comes down. So you can use these two products to help you come off the nicotine. But like I said, a lot of people ask whether, I should just stop or I should decrease and stop. Yeah. And a lot of the time, I say it's entirely your decision. If I were to be doing it, I would probably say I would do it cold turkey, because you're just prolonging the agony a little more. But if you do have very significant levels of dependence, high levels of dependence, then going cold turkey may be quite brutal. So you may want to drop it down to a little bit lower levels and then stop it. So it's entirely personal decision, and also it depends on the level of addiction. And once you stop, you can use these nicotine products for a few weeks, and then you can try and come off the nicotine products after a week or so.
Right. So what I hear is that you're saying that use the lockdown as an opportunity to quit, and use the lack of access to cigarettes as a boon rather than a problem. But one of the questions that we did, and I can imagine, I can see how this is scary, is I've been smoking for almost 20 years, and the lockdown is really affecting my mental health. I'm scared that I'll be unable to quit without losing my mind. What do I do? And this, I imagine, is a real problem.
Correct. So someone who's used it for a long time would definitely find it extremely hard to come off these cigarettes. Now, one of the psychological effects of coming off tobacco or nicotine is that decrease in concentration, the restlessness, that would feel like I am going mad. But what you need to tell your brain is, all medical evidence proves that you're not going to go mad. You are going to have decreased focus, decreased concentration, increased restlessness for the period of the withdrawal. And usually withdrawal starts anywhere between 8 hours or 4 hours post-dose, depending on how bad your dependence is. And day 3 or day 5 is your peak withdrawal symptoms. And by, I think, day 10, day 12, you're pretty comfortable usually. And by 4 weeks, you're completely back to normal with respect to withdrawal symptoms, at least. So rest assured that you're not going to go mad, that these symptoms are temporary. There's no permanent damage caused by these withdrawal symptoms from tobacco. So you do not have to worry, and you have to keep reiterating to your brain that it is very unpleasant, but not dangerous. You have to deal with it, and if you're still struggling, I'd say visit a psychiatrist. There are medications we can give to make you feel a little better, to make this craving go away a little bit, to make that restlessness come down a little bit. So if you have high levels of dependence and you're struggling, and even with the use of nicotine replacement products, you're not able to manage it, then I'd suggest visit a psychiatrist and they can help you with some medication.
I'm moving to some questions that we have from our audience. Liba asks, can you please explain how tobacco usage affects appetite as a withdrawal symptom?
Yeah, so people who smoke say that their appetite reduces when they smoke. So it decreases, the need to eat, and people tend to be slim. And some of the youngsters don't want to quit because they worry that stopping cigarettes will make them put on weight. So the effect tobacco has is a reduction in appetite. So if you use tobacco or nicotine, your appetite is suppressed. So naturally, when nicotine goes away, so you withdraw it, a lot of the patients or clients say that their appetite has come back and they tend to eat more. Now, a lot of people actually say that they crave sweets more, though there is no active medical evidence for this. The medical evidence does say that your appetite does increase with decrease in smoking or stopping of smoking, which is probably a healthy thing. It'll just take you time to balance it out. You're going to eat better. All you need to do is that you ensure that you exercise or manage your health better, such that you do not put on excessive weight. But I've not seen anyone bloat out completely just because they've stopped cigarettes. Yes, they may add on a couple of kilograms because they're eating better. But as long as it's a good move towards your health, even those extra couple of kilos may be adding to your health rather than worsening your health. Balance it with some exercise and you should be okay.
Right. One question that we have is, I smoke to de-stress and I don't have access to cigarettes at this time. How do I cope? And I think this is something that applies to those who also have an alcohol dependence, that it is seen as a way to cope with a high stress situation or a cue that is stressful. I don't know if you would like to answer this as a combined, or they work differently for the two substances, or for any other substance for that matter. How do we work with this?
So all substances, there's usually a chicken and egg scenario. So we always have, as addiction consultants, a worry that did they start using the substance because they just started using the substance and then they developed anxiety or depression or stress or whatever they have in their life? Or did they have excessive amounts of anxiety, depression, or stress in their life, and that's why they started the addiction? So should we treat the stress and anxiety and the depression first, and then the addiction, or the addiction first and then the stress? But now, because of the lockdown, we have no choice. Your addiction has been taken away forcibly out of you. So whatever remains exposed, we will have to manage. So for general stress and routine day-to-day work kind of stress or family stressors, you will have to find alternative stress management techniques. And this is the best chance for you to find stress management techniques. So start off with small things. So don't expect to achieve a lot of calmness in the first few days, because the first few weeks, your body is going to be struggling with the withdrawal of the drug itself. So all you want to do is calm down the brain and the body a little bit. You're not going to be in peak performance, and don't expect to be in peak performance. But during this time, what you're doing is trying to identify other stress releasing things that you can do. So for each person, this may be different. So before your addiction started, think about what would you do for stress release when I was not smoking. So before I was 20 years old, before I was 18 years old, how did I give my +2 exams? It was very stressful, but what did I do to de-stress at that time? So most of us will find something. So be it music, be it spirituality, be it yoga, exercise, whatever it is, or reading a book, or talking to someone. So you'll have to find other ways to cope with stress other than the addiction. Like I said, the first few weeks when you're going through the acute withdrawal stage might be very hard. You have to be mindful that your body is withdrawing from the substance and you're not in peak performance, and it's okay to be in that state for a little bit. But that's not a permanent state. It's a very brief state. And then I'm talking about nicotine now, and then you're going to be okay and it's going to get better over the weeks. And then you can practice alternative ways of coping with stress and master in those stress busting activities such that you don't need your addictive substance again. However, if your anxiety and if coming off the addictive substance throws up anxiety or depression as an illness, so you're doing everything, you're trying to cope and you're unable to cope, it is quite possible that a lot of people have masked their mental health symptoms by using substances. So they're self-medicating with these substances. If that's the case, you really need to see a psychiatrist to get appropriate medication for the underlying illness and not go back to the substance of use. Again, it's a golden opportunity to identify what is underlying the substance use and to address those issues. They may be psychiatric issues, actual mental health issues, or they may be psychological issues. They may be traumas or, untold things psychologically that may need addressing in therapy. So this is the best way to unmask. Anyway, it's getting unmasked. Dealing with it right now is critical. And all psychiatrists are on your side. We're ready to help. Please seek out for help and we can beat it.
Right. We have two questions, both from, I think, friends and family. One is from Vikram Jha, who says that my friend will not admit that they are dependent on alcohol and other banned substances. And likewise, Aishwarya asks the question that is it effective to continuously force someone to quit smoking and use the opportunity of the lockdown, or will this be counterproductive? So I think in both cases, questions on how do you convince someone to go down the route of de-addiction? And what can friends and family do in this situation?
So outside of the lockdown situation, so we always say, as addiction specialists, we always say de-addiction cannot be a forced thing. It has to be a self-realized, path that the person takes for themselves. Saying that, if someone is in pre-contemplation, as we call it, as in they don't even agree with you that they have a problem, they think that they're fine and that you're making a big fuss about it, we still are okay as addiction specialists to see these people in clinic, just to have a chat, just to move them from the pre-contemplation stage and to give them evidence psychologically to say why they do need help, why they should come into treatment. So rather than forcibly asking them, we call this technique as rolling with resistance. Whatever resistance they're giving, we are not resisting, we're not going, against them and fighting against them, but we're rolling with it and trying to find other ways to convince them into why it is not true that they're not dependent, why it is true that they are dependent, and why it is true that they do need help. There's usually one or two windows always open. It's never that all windows are closed. We just have to find the right window to tap in. So I had a person who was a patient, mental health patient, but was always smoking incredibly large amounts of cigarettes. And no matter what I said, he would say, you can give me all medications for my mental health problems, but I'm not quitting smoking. Don't even talk about it. But we'd always have a conversation about it, saying how I'm worried about it and how his lungs might get affected about it. But then he had a baby. And then he tried to kiss the baby and there was a rash on the baby's cheek. And that was enough of a window for me to say, you've got to change now, otherwise your baby's going to get affected as well. And that was the key for him to change into not smoking. So finding that specific key in each individual is important. Just banning the whole thing and just forcing them to do it may not be very useful. But saying that is in an ideal situation when we are not in a lockdown. But right now there is lockdown, and you like it or not, substances are harder to find. Yeah, and so right now, if they are having withdrawal symptoms, if they do have tremor, like alcohol, people who drink alcohol regularly, who say, I'm not dependent on it, but start having tremor, all you need to say is, okay, you're not dependent, but let's get this tremor sorted. Let's go to a doctor. We don't need to establish that the person is dependent or using substances as harmfully. We just need to get them the appropriate help to make them comfortable. And I'm sure everyone wants to be comfortable. So if you just say that we are out to help you to make you comfortable, it should work.
Right. Since we're on the topic of what family and friends can do, likewise for someone who is convinced that they do want to traverse the journey of de-addiction, both for alcohol and for nicotine, what does the community around them do? How can they help? Do you usually also counsel family on how they can contribute to better health?
Yeah. Society and close-knit family are crucial to recovery from addiction. So if you do not have a supportive environment, the likelihood of you coming through de-addiction and maintaining abstinence long-term is harder. Yeah. So critical comments from people we love is always the most difficult thing for the addicted person. So being supportive in the sense, because it's also important to understand these families. These families probably have gone through the trauma of living with a person dependent on a substance, affecting them financially, psychologically, socially, all the time for years and years. They may have been domestic abuse. They may have been, various issues related to the substance abuse. And we as professionals are then going in and asking these families to forget all of it and then just look at the changed person and accept the changed person as changed and move on. And most families may find this extremely hard to do. So definitely, you're right that any addicted person The family is very critical. Family will need equal amount of psychological support. In the context of the lockdown, what I'd suggest is understand that your loved one is going to go through difficult physical and psychological time the first 3 to 4 weeks of stopping any substance. So understand their irritability, understand their need not to be able to socialize, not to be as perfect in their work, not to be able to focus in their work, not to be able to, not being able to concentrate as much. So understand that these symptoms are not because they're lazy or they're making up some excuse. These symptoms are actually happening. It's like having the flu or, having illness. So, so being just as supportive. So giving them nutritious food, having, just tender loving care during this time in the lockdown is very important.
Right. We have another question which says that my big problem is sleeplessness, which you did mention as one of the issues that come along with the withdrawals. Is there a way to regulate this?
So insomnia related to nicotine or alcohol? Both?
They don't mention it, but perhaps we could address both.
Both. So insomnia can be a problem with a lot of substances. So because, like I said, the brain's in hyperdrive, it needs to slow down. Medications we could give plenty if you visit a doctor. But if there's no doctor, is what you're saying, if you're locked up and you're in the house, you're in a lockdown situation. So doing all the routine normal things, having day-night schedule as best as possible. You're going to struggle for a few days. Like I said, for a week, you're going to struggle to settle in. But making sure you have the right time to go to bed. So just because you're not feeling sleepy, don't sit in front of the TV till 3 a.m. And then the problem will be you'll wake up very late the next day, and the cycle will continue, and it's going to be very messy to change it later. So if you just follow some basic sleep hygiene techniques, as in go to bed at the same time, wake up at the same time, have a bedtime routine. So calm down at just a few hours before you go into bed. No excessive activity just before bed. No gadgets, no bright lights inside the bedroom. So all gadgets, all TV, all laptops, all Netflix should happen outside the bedroom. Nothing should be taken into the bedroom. Making sure that if you're not able to sleep, you come out of the bed and sit and read a boring book or do something really boring and wait till you're sleepy enough to go back to bed. And if you don't sleep even then, so say some people say, no, I did all that, but even then I slept only at 3 a.m. I'd insist that you still wake up at 7 a.m. or whatever the normal time that you do wake up, so that at least the next day you're tired enough to go into sleep at a more reasonable time. So say at 2 a.m. So you might bring it to 2 a.m. and then 12 midnight, and then it'll slowly come back to normalcy. But if you're struggling too much with it, again, see a psychiatrist and it can be sorted.
Right. I think one of the questions that we get quite commonly is for those who are managing a lot of their mental health symptoms with addictions of one sort or the other. And I think these range from nicotine to alcohol and other kinds of substances as well. So under those circumstances, and these are severely difficult times, especially if you have a common mental illness or a severe one. What would you say to this audience in specific? And I can't imagine that there are generic answers, but if we could just do an overview of what they could do to help themselves.
So it's well known in medical literature that people in mental health services, so people who have sought mental health treatment, have a higher proportion of addiction to substances than the general population in any country. So just the stress of having a mental illness makes you more vulnerable to an addiction anyway. And like I said before, it's a chicken and egg situation, and the addiction is going to worsen the mental health, and the mental health worsens the addiction. So in the same way, the withdrawal symptoms are probably more severe, and more the psychological symptoms of withdrawal will be more difficult to handle. by a person who's not completely mentally well. So and as the other risk with high levels of, say, even simple cigarette smoking, if you're smoking very high levels of cigarettes, like I have patients who smoke 40 cigarettes a day. So if you're smoking that level of cigarettes, it does things to your metabolism, and you're on other medications for mental health. And it goes from 40 to 0 suddenly. Then the levels of your medication also changes in your blood, because you're not metabolizing it as fast as you would if you were smoking that much. So there's a whole load of complexity with regard to presence of mental illness, presence of mental health medications, psychotropic medications, and having an addiction as well. And if in these circumstances you're withdrawing, I'd suggest at least have a teleconsultation with your psychiatrist as a minimum. If it's mild to moderate withdrawal symptoms of things like cigarettes or weed, cannabis, which are non-dangerous physically, then you can use the same techniques that I've said to the general public, all the calming techniques, finding alternative stress coping mechanisms, and making sure your day-night cycle is maintained. If that does not solve the problem, then you have to see a psychiatrist immediately. Say a person who has bipolar affective disorder suddenly stops cigarettes from high addiction levels, and then experiences insomnia, lack of sleep. They may flip into a depressive episode or into a manic episode very quickly because of the lack of sleep. So in those circumstances, insomnia, every symptom becomes more dangerous than in the general public. So if you have pre-existing mental illness, please make sure you have some form of review by your psychiatrist.
Shripa Sharma asks a question, but perhaps we can go into a little more detail, saying that sudden withdrawal is causing a lot of frequent mood swings and is causing increased stress. How do I deal with this? Has not mentioned whether this is a nicotine or an alcohol addiction.
Yeah, so I'd assume it is nicotine. Yeah, so the irritability, the restlessness, the mood swings, feeling, completely unable to cope with whatever is happening at home is quite typical of cigarettes or even other substances like weed or, cannabis or something like that, or other stronger substances as well. So you'll have to do all the normal things that we discussed so far, trying to normalize life as much as possible, being active throughout the day, diverting your mind into other activities, and always consciously, cognitively changing this thought that I'm going to go mad, I'm not going to be able to tolerate this, and saying to yourself that this is not dangerous and it is self-limiting and it is going to go away in a few weeks. But again, like I said earlier, if it's severe, please contact a physician or a psychiatrist. And depending on the substance of abuse, it can be dangerous.
Right. So assuming that, that someone is on the path of de-addiction during this time and, using this time as a period to actually wean off any substance use, what do you predict when life rolls back to normal and access is then given? Is there something that they should be prepared for at that point in time? I imagine that is also a tough one, to have access.
That can be equally dangerous, actually. It can be equally dangerous for life and health. So people who have been using a set amount of substances, a fixed amount of substance all these years, have now suddenly stopped and somehow managed the withdrawal symptoms without medical help. And then their body has withdrawn completely. Their body has become pure and, zero of, it's become clean of that substance completely. And then they suddenly open the shops again, or access to even the illegal. This is more relevant for illegal substances. The illegal substances become more prevalent again. You go and use the same level of substance, you're at risk of having a severe overdose because your body is not used to that level of substance anymore. So you cannot drink or have or smoke the same amount of substance at that time. You've got to be as if you were starting. So if you're 7 days of whatever substance you're taking, your body is technically free of that substance. It doesn't remember it. Your brain does, but the body itself doesn't. So you have to act as if you're smoking your first cigarette, or it will pick up very quickly. The problem is it's a very slippery slope, and you will go back to where you were very quickly if you do it. But the first time you do it, it cannot be at high levels. So that's the biggest risk, as in after a period of abstinence, going back into any substance, you have to be extremely careful, because your body will not be tolerant anymore of those substances. You will have severe reactions to that same substance, though you've used it for many years. So I'd say be careful. But if this person is motivated and have managed abstinence, yeah, and they want to continue managing abstinence post the lockdown period, you have to start becoming aware that the temptations are suddenly going to come out all at once. Everything's open. It's again, it's like coming out of a locked world. You were in a very safe environment and there was no access to anything. So craving was very minimal. And now that the lockdown is done, you have access to anything you want. So craving is bound to increase. And that may lead to a lot of guilt and self-reproach and all that. If you want to continue to maintain abstinence as well, seek out help from a psychiatrist or an addiction specialist, either through medication or through psychological therapies. You can continue to maintain abstinence. It's a good time if you do want to keep abstinent post-detox, post-lockdown as well, is to make charts of why you've decided to quit. So make a list of things that motivate you to quit, and make that list very alive, as in it should be very accessible to you all the time, because temptation is going to be there coming from all directions all the time. So I'd suggest to my patients, put it on your screen on your phone. So if it's for your child that you're doing, put a beautiful photo of your child on your phone, so that every time you're with your phone, you know that the reason why you quit, the reason why you made the decision to maintain abstinence. Yeah, so write down all the important things. And I don't know, things like financial costs. So if someone is smoking 1 pack of cigarette a day, they're spending something like 200 rupees a day just on cigarettes. So in a month, they're spending so much. So they write it down somewhere and keep it in their wallet. So every time they are about to take a card out to pay for a cigarette or take money out to take a cigarette, they realize that how much money they're going to end up spending in a year and what they could do instead of lighting up that cigarette. So keeping that list of reasons why you have decided to quit very alive, even before the temptations come back into our life, is very important. So make a list, keep it alive, be creative, make it alive all around you, and if needed, create a wall around you. So what we say is, it's like building a fort. So it can be things that are tangible and untangible. So psychological forts, like I said, something emotional, saying I'm doing this for my mother, my daughter, or I have, in Indian context, I have given it up in the name of God. Something very emotional, psychological, or physical. So making sure your friends, family, close ones know that you've quit and you intend to remain quit. And so the first few weeks after the lockdown period is over, making sure that someone accompanies you whenever you're going out to places where you are likely to slip. For that, you need to be very self-aware. Make a list of places where you're likely to slip. Which is that shop you buy it from? Which is the road where you go to buy the cigarette or the alcohol? And when are you likely to cross that road? But saying that, I do know cigarette and alcohol is available at every nook and corner in Bangalore. So you can't always have a policeman next to you. But building that fort as much as you can, such that you are protected. So making this abstinence plan is very critical if you really want to quit the substance long term.
Right. We have a follow-up question from Shripad, who initially asked about the mood swings, and I think we answered that in the context of nicotine. But he also says that I've used this time to de-addict, but I've run out of both cigarettes and alcohol, and I'm finding it increasingly difficult to deal with emotional stress, and it's really becoming quite difficult. As a supplement to that question, I also am wondering if a lot of people can also start using a lot of the helplines and voluntary counseling options that are coming up, and what does one do in a situation like this, because they are talking about a lot of emotional stress.
Yeah, so getting access to some form of help as quickly as possible is critical. Like you said, there are a lot of helplines open. Indian Psychiatric Society has opened a all-day helpline, which would be answered by a psychiatrist all the time. There are other helplines as well. The numbers of which, quitting tobacco itself has a few helplines. If you go into NIMHAN's website, there are some nicotine helplines that you can get as well. So using those helplines, and if those helplines don't work, accessing a professional to help you through this period is critical. So do not think that you're in it alone. There's enough help out there. You just need to seek out that help.
Right. I think we'll close with that, Dr. Nallur. And if there are any other points that you'd like to make, is there anything else that you'd like to say to our audience?
So I'd say for nicotine dependence, do not panic. It is temporary. It is difficult. It's one of the most dependence-causing substance, and the withdrawal symptoms can be really bad. But try and wean off yourself slowly if you can. And if you have had to do a cold turkey, you've already gone through the worst of it. You're coming out into the light by now. So just hang in there. And if you're unable to cope, please access help. Help is available. And for alcohol addiction, it can be very serious. It's a physical emergency. It's a medical emergency if it is serious. If you do develop severe tremors or nausea or vomiting, please visit a medic as soon as possible. Those are the two take-home points that I'd like to give.